go ahead and call the meeting to order. Welcome to the July 9th Durango City Council meeting. I hope you all had a nice 4th of July and enjoyed the festivities. We had a nice break here at City Council with no meetings last week, but we're here tonight we're starting our second meeting. We're having a double header. We just finished a study session, so sorry for the little bit of a late start. I wanted to thank you all for joining us, and thank you for those of you joining us live on DGov. We're happy that you're tuning in. As I start, I just wanted to remind all citizens that as a City Council, we support the efforts of the Durango Community Relations Commission, and we have adopted their Civility First Pledge program, which is a program that supports and encourages social harmony for all residents and visitors, where all are treated with civility and respect. And as a council, we operate under this pledge and we run our meetings accordingly. I want to welcome our community to participate in our meeting tonight. There will be several opportunities for public participation, and you can also speak during our public hearings. If you know you'd like to speak, if you could please sign up now so that we could plan our meetings accordingly, we would appreciate it. And with that, Ms. Phillips, may we have a roll call, please?
Certainly. Councilor Baxter?
Present.
Councilor Bettine?
Here.
Councilor Noseworthy? Present. Mayor Pro Tem Brookie?
Here.
Mayor Youssef?
Here. City Council, do we have any actual or perceived conflicts of interest this evening? None noted. And we have one presentation tonight from San Juan Public Health, Transforming Data into Action. And we have, can you please say your name and address at this podium for us?
Kristen Pilati.
Pilates.
Yes.
Thank you.
Absolutely. So what do I, just click on this guy? All right, so thank you so much for having me here tonight. I'm Kristen Pilati, and I'm the Director of Assessment and Planning for San Juan Basin Public Health. Some of you are thinking, wait a second, she looks familiar and pieces of this presentation look familiar, and you are correct. I was here back beginning of April giving you a little bit of information about our community health assessment and our public health improvement plan. So what's changed since then? Well, we have some new council members. That was election night, as I recall, so we might have a little different perspective here, another opportunity to talk about that process. We've also published the community health assessment data document that backs up all of this information. So you have that, I believe, in your agendas, but just if you haven't seen it, we have an 80-page document of data that we collected from a science review as well as a community survey that is now published and available to the public that was not back in April. We've also begun to operationalize our actual plan. So it looks a little bit different when I'm here talking about the theory of our plan, and now we're actually using it. So the perspective has changed a little bit, and I can maybe answer questions in a different way than I could have in April. So I will get started on that. So what does the Assessment and Planning Department do at San Juan Basin Public Health? We're responsible for performing a community health assessment every 5 years and using information from that assessment to develop a public health improvement plan, which is basically our strategic plan for the next 5 years. And both of those activities are things that are required by the Public Health Act of 2008 for every local public health agency to do. So we are in compliance with that, and it also means that we use data to drive our programming. My division also assesses our ongoing programs to see whether they're doing what we say they're doing, and we collect new data to say, are there additional programs we should bring in, or should we change the direction of any programs that we currently have? So the community health assessment, which we call the CHA, is a survey that was available to all residents in Archuleta and La Plata counties. It was intended for adults, but we really didn't have a mechanism of saying, no teenagers can take this. I don't think they skewed the results, but I suppose it's always a possibility. Again, we are required to do an assessment, but we're not told how to do that assessment. The state leaves that up to every local public health department. So that's why we used a survey, and we combined that with a data and literature review to use all that information to drive our strategic planning. So in our survey, we asked 20 questions about community health. We did a couple different formats to try and get answers in different ways, and to ask people to prioritize issues in their communities that were impacting them. So we had just over 1,000 surveys completed, and you can see the breakdown here between Archuleta and La Plata counties. It's really in line with the population breakdown. It was a statistically significant representative sample in La Plata County. And we did have a few people take the survey in Spanish. It was made available with a professional translation. So that's how many people here took it? Wow, good job, you two. 3, okay, great. Well, I'm glad that you 3 took it. I took it too. So the first question we asked was completely open-ended, and we said, what's the most important health issue facing your community right now? What impacts your life? And so people could write in absolutely anything they wanted, and then we coded their answers according to our program areas. And you can see, if you can read those numbers, on the left-hand side, that things that are colored blue are things like mental health, substance abuse, prevention or promotion activities, and health behaviors. And those are the word codes that people really associated with health when left to their own devices. If you look on the right-hand side, there's more of those environmental health issues like water and air quality, environmental health, that's separate from those because we have some programs that are very specific to environmental health. And then emergency preparedness and response, only 2 people out of over 1,000 really called that out as the most important health issue. This might have looked different if the survey had been after April last year, right? Because air quality looked a little bit different in June. So we also recognize that a survey is only a snapshot in time and that it doesn't encapsulate absolutely every issue that could happen. So then we looked a little bit differently and we gave people answers. And we said, just give us a number from 1 to 4 about what's the most important health concern facing your community today. So 4 being the highest or the top concern or the worst, this is how this shook out. So people said suicide or suicide attempts, affordable housing, substance abuse, poverty, and availability of jobs or economic opportunity were the top things, far and away, that were the issues impacting the health of our communities. Right, so this tells me a few things. First, these scores are pretty close to 4. They're pretty important and people think they're pretty severe or really impacting their health. They're all really complex topics. So if the number 1 issue had been, I can't figure out where to get vaccines, I really could have solved that problem, right, in probably 2 months' time. Solving something like affordable housing is a really complex problem, and I think all of you here know that. And it's also not necessarily within the purview of local public health. We could be a partner agency on a lot of these issues, but they probably won't be the things that we address all by ourselves. So when I look at those concerns, I say our community has told us very much they understand that these things called social determinants of health, which are all the factors about where you live and where you work, they understand that those impact their health just as much as what's their genetic makeup or if they're seeing a doctor. So our community gets it, and we just have to be creative and responsive with some pretty big projects to address these concerns. But what people didn't call out, again, was environmental health. So we've asked this question a couple different ways now, and people aren't necessarily identifying that they need clean air or clean water or healthy and safe foods. Chronic disease prevention, right? So we know that the biggest causes of death or years of life lost in both counties are cancer and cardiovascular disease, and that's the same as it is across the entire country. And yet that's not what comes to mind when people are thinking about health issues. So they might know those happen, and they might know that the biggest killers, but they don't think about them when they're answering a survey. People didn't necessarily talk about public health concepts like vaccination, and again, emergency preparedness was not at the forefront. It might be different if you're worried about flooding coming from a burn scar and evacuating, so it could be the time of the survey, but people didn't call those out. So that tells me that I can't just listen to the survey, that I have to look at what the law tells us that we're supposed to provide at a local public health department. I should take into account what the community's told us, but I should also look at data and statistical need and what the biggest impact of our programs will be, as well as listening to our staff who have years and years of experience and expertise in public health programming. So we don't just look at that community health assessment, even though we now have 80 pages of data on it, we also have to add in a few other factors. So I believe this is where the presentation cut out last time I was here. So this is all new information, and it's very exciting. So this is what our new 2019-2023 Public Health Improvement Plan looks like. And I will talk a little bit more specifically about these issues because I recognize it's kind of hard to read on the screen. But basically what this is a roadmap for us for the next 5 years. It allows us to focus on specific issue areas, but it also allows us to be nimble. So if an issue area like behavioral health is suddenly solved in our community, we can move more resources over to emergency preparedness and response. Another thing to recognize about the way that we call these issues out are that, like most local public health agencies, the majority of our funding is categorical funding. So it's from a grant or a contract that's tied specifically to an issue or an activity. So we can't just say, well, we have this money that we're going to shift into another realm because it's probably tied to an issue area. If you don't call out specific issue areas in your public health improvement plan, you're often not eligible to apply for grant grant or contract funding to address that issue area. So if I didn't say that behavioral health was an issue in my community, if a grant for behavioral health became available and they said, but it doesn't line up to your public health improvement plan, we might not even be able to apply for it. So you have to be pretty strategic about what issues you call out. You can't have a plan that has 50 different strategies. That wouldn't make sense. But it's also very challenging if you only picked one, because then you can't change very much over the next 5 years. So that is why we came up with 7 issue areas, and we apply 3 different goals to those. So I will explain what that looks like. Those top 3 priorities, the ones in blue, were the ones that we decided were the most urgent and pressing priorities for us to work on. So when you see the social determinants of health, that links right back to that slide where there were those 5 issues about suicide awareness and poverty and economic opportunity. Our community told us loud and clear, we want you to pay attention to those issues. So we put that on our plan. Behavioral health was one of those issues, but it was called out so strongly and so specifically that we said it deserves its kind of its own issue box, right? And then environmental health, I showed you, wasn't really called out by the community, but it's something that our staff and our expertise kind of said, we really need to focus on these programs, because if you don't have clean air and clean water, it's incredibly difficult to be healthy. Those are pretty baseline activities. So that's why those are our top 3. But we have additional priorities, and they're not unimportant, but I'll kind of show you why they might be secondary. So if you look at health behaviors on the bottom left, a health behavior is a choice that you make that can improve your health. So one choice might be wearing a seatbelt or choosing not to use tobacco. Those are things that impact your health. But maybe you're using tobacco because you're so stressed out about your lack of jobs in your community that that's your coping mechanism. So we're telling you to change behaviors, or maybe improve, go to the gym or buy healthier food. But if you're struggling because you can't get a job that pays a living wage, it's really hard to make those behavior changes. And that's similar to emergency preparedness and response. If we're telling everyone in our community to have a 3-day kit of supplies, and you should have some cash, and you should have some extra medicine, if you can't pay rent, you're probably not going to make a kit with extra food and extra money. Clinical care linkage, which is on the top left. So public health, we do have some direct clinical programs. That's something that public health does, but we also see ourselves as a community convener. So you might come to us for one program and mention, well, I don't actually have a primary health care provider. And we can say, great, let's connect you to that resource in the community so that you have one primary source of care and you're not getting care all over town and it's really fractured. We want everyone to have the appropriate clinical care linkage. And that might not be us, but we're very happy to perform that role of getting people to the right place. We're not a primary behavioral health care provider, but we're very happy to show people what resources exist in the community to get them there. And then finally, communicable disease. This is kind of a bedrock activity of public health. It will probably never not be a public health priority because no one else is going to be doing the surveillance, epidemiology, prevention, and tracking of communicable disease. It's something that public health has done and will continue to do. So we said we're going to call that out as a priority area and make sure we have the resources to do it. So I'll just pause and say, any questions about the priority areas that we're going through? Okay. So how will we address those? Well, we have a strategic plan. What you're not seeing today are the 28 pages of Excel documents that have all of these activities based on those priorities, right? Because that's a lot to sift through, but we did create that in the background. So we'll be measuring progress on all of those issue areas. But what kind of drives those activities or that progress? Well, we created 3 goals to apply to all 7 of those activities. So the first goal is to improve community resilience. And there are a ton of words on this slide, but what you should remember about it is that we want to improve awareness of resources, acceptance of them, and access to them, right? So we want people to know that we provide services, to understand that they're scientifically based, and be able to come get them. So if you take that out of theory and apply it to communicable disease, which again is one of our 7 priority areas, that means that we'll do disease education. So we have an epidemiologist, for example, who does education about zoonotic disease or communicable diseases that you might find in Southwest Colorado. We also need to help people accept that there are ways to prevent these diseases, right? So one of our questions that was just a yes/no question was, do you get a flu shot? And we had 600 comments about people voicing some questions about flu shots and about the effectiveness of vaccines. We realized we need to think about the way we're talking about public health concepts out in the community. And then finally, that access piece. So maybe you really want to come in and get an immunization, and you're really all up on the science. You say this is a great idea, but if you can't afford that, then the other things don't really mean very much. So we think those are all critical components to improving community resilience. The second goal is about improving organizational capacity. So that is about making our staff the best trained staff, making sure that we have sustainable infrastructure and programming, that we have learning and growth opportunities for our employees, and that we have effective administration and governance. And those are all really important things to make sure that our public health department keeps running, and that we don't, create a program and it's very popular and then suddenly all the funding went away, so we took that away from the community. So we really want to think about those sustainable programs. So how we might apply that to a top priority like environmental health is making sure that we're always on the lookout for appropriate funding opportunities. So sometimes we do things like radon awareness grants, right? So we know that that's a big deal in Southwest Colorado. Or maybe people are looking for well water testing. We know, again, that's a really big deal in Southwest Colorado. A lot of people have wells. So being on the lookout for those funding opportunities. Making sure our staff are fully trained and certified, so if we have restaurant inspectors, that they're all up to the same standards and that they all know exactly what they're doing when they're doing retail food establishment inspections. Fiscal responsibility, that we're charging appropriate fees for the programs that we offer, and then legal authority. So environmental health is highly regulatory. There's a lot of things that are Colorado state law that we're tasked with addressing in our community. So we want to make sure that we're actually doing retail food inspections correctly, that transfer of title and on-site wastewater systems are being inspected appropriately. So making sure we're up to date on that is very important to continue trust in our community. And then finally, public health innovation, and this is where assessment and planning really comes to shine. This is all about collecting data to then create innovative programs to address emerging needs, and also to give good recommendations to our partners and policymakers, so people like you, so that you can do your jobs with the best public health information, and not wonder, I wonder what the impact of what we're talking about is going to be on the community. So if you look at how to apply that to something like behavioral health, that means we collect evidence. The first way we do that is just listening to community members, because anecdotal evidence is still evidence, right? So learning, hey, there's some behavioral health issues going on in our community, doing some research on that. Hey, Western Colorado actually has maybe some higher incidences of depression or suicide attempts, so we should probably look more into this. Looking for programs that might address that issue, and so there have been some behavioral health funding opportunities that we've brought to the community and that we've worked with partners on, because again, we're not necessarily a behavioral health provider, but we think it's important to partner with other stakeholders on prevention or on addressing issues like behavioral health. So how does that impact all of you? Well, you have this greatly improved health indicator data that I'll keep pointing out so that everyone can pull it up. Our programming should be really responsive to community needs. Our workforce will be highly trained. We'll be a sustainable organization, continuing the programs that our community comes to really appreciate, using best practices, and eventually seeing improved health outcomes in our community. So that is the short version of the CHA-FIP. Are there any questions?
I have one. In some of the data that you have here, I just wondered if you might comment on how it might compare to other communities around the state. In particular, early on in the report, it asked the question of the respondents if they feel that the community is healthy, and that it looks like most everyone thinks that at least somewhat healthy, but there's a large percentage that says just somewhat healthy. It's like 43%. And I wonder how that compares to other communities across the state, maybe the country.
Sure. So every county or local public health agency in Colorado is at some various stage of this process. It doesn't mean that they're all in the exact same stage as us. So I'll kind of preface with that. And again, not everyone asks questions in the same way. So if people didn't ask questions about how do you feel about the health of their community, I might not be able to access that. I will say that something that was a continuous theme with almost every county in Colorado was that behavioral health issues really rose to the top, and then concerns about affordable housing and living wages in Colorado were things that have pinged across the state. So I think there are some common concerns there. I think we've had different concerns perhaps about substance abuse that have not risen to the top in the way that they've risen in other places. I also think that this the responses look very different based on the responders' demographics, right? So some people took this and they're doing great, so they see the community is very healthy, and some people are really struggling who took this survey. So it's hard to give one general answer to does everyone kind of feel the same way in the state, but I would say many of our challenges are very similar, they're just scaled differently for this community.
Are we skewed, my follow-up was actually about the behavioral health, are we skewed higher in that regard than other parts of the state? I think we've heard that in many different places that we've been, like in CML. I'll say statistically that there's a higher preponderance of suicide or behavioral health issues. Is that reflected in the data that you see here too?
Yes, and it's really all of the kind of Western Rocky states, so it's not just Colorado, but Colorado has been in the news a lot for kind of suicide and suicide attempts and depression. But there's a larger trend that's often discussed in these Western states, and there's a lot of different reasons for that that are kind of complex. So you can't just say it's one thing, it's not just the location, it's not just because you're rural, it's not just because there might not be access to providers. So there's a lot of things that play together, but it is a common theme.
Any other questions from council?
I have two. First of all, thank you. Thank you for this information, your plan, and for providing the public health services in this area. My large question is, are there things that we can do as a partner with you that we should be aware of, things that we could do to help you advance this, and ways that we can strengthen our partnership? So that's my first question.
Sure, absolutely. So I think a lot of the examples in that first question about those social determinants of
Housing,
health, which
certainly.
is a super jargony way of saying that, but all the things that aren't just a healthcare provider
Right.
given, right? So any opportunities there to work on affordable housing, or even the public health lens of economic development. So we wouldn't purport to tell you how to do those things, but if you said, well, what's the health impact of a program? We'd be really glad to share data or to do some research or partner on that, support grant applications, and really make sure that all of our community partners have the resources they need to do their work, because we know there's a lot of different expertise that doesn't necessarily live at San Juan Basin Public Health, but we hope to support it and offer that public health lens.
Through our community support program.
Absolutely.
Okay. My second question is at a much different level, and I actually told Leanne that I wanted to be prepared. I had asked, for this meeting both to hear this and to also ask a specific question about the organic management. So I'm going to go from the 30,000 down now. I know that San Juan Basin Public Health did some kind of analysis of what we use, and I was just wondering, I know that report is a little bit dated, but I wondered the conclusions of that. Could you just kind of state for us where you're at with the organic management and the herbicides, pesticides, things
Sure.
that came out of that?
I can start us off, but I will say I'm not a subject matter expert
Okay.
on this. So 2 years ago, our staff did an overview of some toxicology information, a literature review of scientific evidence that was available talking about health impacts of some pesticides. And so the person who did that literature review is our regional epidemiologist, and she just happened to be here, Rosalind Penny, and so I think she could answer more specifically the outcomes there.
If you could please state your name and address for the record.
Yes, good evening. I'm Dr. Rosalind Penny. I'm the regional epidemiologist at San Juan Basin Public Health. And as Kristen mentioned, 2 years ago, I did a presentation that discussed basically a framework for thinking about risk. Risk is a very difficult thing to assess, and so we discussed how risk might be looked at through the park system. I did do a quick review of toxicology. Toxicology is a huge field, so trying to condense it into 3 slides is not very easy, but there is a very brief discussion of toxicology. And I also did do a literature review on all of the chemicals that were being used by the park system at that time. We utilized peer-reviewed journal articles, as well as the safety data sheets that are available for each of those chemicals or chemical combinations that were being used. Our conclusions there were 4 major ones. So there was really no clear way to completely assess risk in a parks system because we have many exposures every day. So it's not like we can say, well, this one exposure, unless it's a huge exposure, like we have a large accident and a chemical spill. That might be one way that we could assess that risk. We also found one chemical that had conflicting research about it. So some of it said, yes, it's okay for human health. Some of it said, no, it's, not okay for human health. We presented that information to the Parks program, and they indicated that they would take that into consideration with their system. We noted that there are a majority of parks that do not claim to be pesticide-free, and that none of the information that we've provided is able to state that there is no risk as well. So those were the basics of our presentation. I'm happy to do the presentation again, including any new information that may have come up. Research is very slow, so it's not going to be a lot of new information, but there is some new stuff that's out there now, and provide all of that to you again.
Can you tell us which chemical had the conflicting reviews?
Yes, it was glyphosate.
So it sounds like you're saying that it was in some ways inconclusive, and that you weren't making a recommendation to use or not use certain
Correct.
chemicals. Okay, because I wanted to be that clear, because I got maybe it was just me, I got the assumption that, or I got the impression that you had, the San Juan Basin Public Health had actually said, yeah, these are okay to use, but it sounds like you're saying
No.
it's inconclusive.
It is very inconclusive, and there's no way that we could make any kind of recommendation.
Okay.
We are not toxicologists at San Juan Basin. We don't do those types of studies. And we are just here to provide education and not a recommendation in this case.
Okay, thank you. Thank you for clarifying that for me.
Further questions from council? Great.
Thank you.
Well, thank you very much,
Thank you.
Ms. Pilates. We appreciate it. Okay, we're going to move on to a review of the consent agenda. This section of the agenda is intended to allow City Council by a single motion to approve items that are considered routine or non-controversial, and items discussed in this part of the agenda will not be considered separately by council unless a councilor removes an item from the agenda. Those removed items will be considered under agenda item number 7. Ms. Phillips, may we please have a review of the consent agenda items?
Item 5.1 is approval of the minute for the study session of June 11th, 2019. 5.2, the approval of minutes for the regular meeting of June 17th, 2019. 5.3, discussion and possible action regarding an implied consent agreement for Junction Creek Mobile Home Park. 5.4 is a request for public hearing for July 16th, 2019, to consider amendments to Chapter 19, Article 3 of the City of Durango Code of Ordinances to grant authority to appointed police service technicians to enforce the municipal code. 5.5 is a request for public hearing for August 6, 2019, to consider a request from GRVP LLC for preliminary development plan approval for the Three Springs Crossing development. 5.6 is a request for public hearing for August 20th, 2019, to consider a request from Animas River Ventures LLC for rezone and conceptual development plan approval for the Animas River Commercial Center development.
Thank you. Council, do we have any councilor that would like to remove a consent agenda item tonight? Okay,
I'd like to remove 5.4, please.
5.4. Do we have a motion to approve the consent agenda items withstanding the removal of items 5.4?
So moved.
Second?
Second.
Ms. Phillips, may we have a roll call, please?
Councilor Brookie,
Yes.
Councilor Bateen,
Yes.
Councilor Baxter,
Yes.
Councilor Noseworthy,
Yes?
Mayor Youssef.
Yes. Okay, let's review the removed consent agenda items. Councilor Baxter?
My question was, I was a little confused as to where the expense for enforcing municipal code things would live. So is code enforcement, or current code enforcement, in a separate bucket than the police situation? And would, if the police service technician was enforcing municipal code, would that be reflected in the police budget or in the municipal code enforcement budget kind of thing? Or how is that managed? Or would it all live in the police department and then get allocated back to code enforcement, or is there, am I looking at this thing, totally bizarrely, or?
Well, that's true. The item before you is to give the new position, the new classification, police service technician, the ability to enforce the code. And these positions are budgeted within the police department. So the budget follows the position.
So who's actually enforcing the code now?
Well, it depends on what part of the code. We have a code enforcement section, and we also have parking people, police department, planners.
So would these new technicians, that category, be able to enforce municipal codes and parking codes and code enforcement also? Or is it just criminal, if you will, codes that they would be enforcing?
It's not criminal codes.
Okay.
It's municipal code. I don't know, Dirk, do you want to help me with that?
Well, yeah, and I think the idea here is that, and of course, this is just a request to set the hearing, so I'm sure the chief will be prepared to give you a lot more information about exactly what the proposal is, but these folks would not be certified police officers, so they would be closer, I guess, in terms of skill set and education and so forth to code enforcement officers, but they are part of the police department. And I think, again, the idea would be, and I would encourage the chief to give you a very specific list of the kinds of things that he's looking for these people to do, and so that you can act on that. And then, of course, the process is we'll have a hearing, and then we'll draft an ordinance following that. So, if we have questions about specific authorities, I would defer to the chief, but I think, again, he will be prepared, I think, at the hearing on the 16th, a week from now, to discuss all those details.
Well, then my interest is in, if the police service technicians are helping to enforce codes that are not specifically police-related codes, I don't want them to bear the full brunt of the cost of that. Does that make sense?
Right. And
So that was where my question was coming from, and so I would really like to make sure that doesn't happen that way, that it gets spread to the actual departments whose codes are being enforced.
Okay. And I do know that the chief's going to be prepared to talk a little bit about budget issues and HR as well. So, again, I think that, we discussed these items a little bit in terms of this agenda item, and because it's just setting the hearing, we decided to sort of leave some of that out, and we'll give it to you in the board packet, the council packet.
Right, and I just wanted to make sure that was addressed in that packet,
Okay.
because if people don't know there's a concern, then they don't know to address it. So,
I think chief's hearing you, and I think we'll do that. Yeah.
well, if there's no other questions, I'll just make a
Okay,
motion to...
please.
I do have a question that it raises. Is this these are the positions that a couple of weeks ago we allocated the budget for the vehicle for?
Yes.
So do we have people in this position already?
Yes, we have one hired, but one that's almost going to complete back in the process.
Okay, thank you.
Then I will make a motion to approve item 5.4 unless Dean wants to.
I was going to second that motion.
Okay, excellent.
Any further discussion? May we have a roll call, please, Ms. Phillips?
Mayor Pro Tem Bricky,
Yes.
Councilor Baxter,
Yes.
Councilor Patine,
Yes.
Councilor Noseworthy,
Yes.
and Mayor Youssef.
Yes. If you have not signed up for public participation, please do so now. Do we have public participation? Okay. This section of the agenda is set aside for the public to provide comments or ask questions for items that are not otherwise on the agenda. When I call you forward, if you'll please join us at up here at the podium and state your name and address clearly for the record. We are limiting comments to 3 minutes, and at 2.5 minutes, our city manager will kindly wave his hand to warn you that your time is almost up. We do not mean to be distracting, but we are trying to run efficient meetings. That said, we very much appreciate what you have to say, and we will be listening intently. We do not normally respond from the dais, but we may follow up with written communication or respond briefly. And with that, I'd like to call, please, Ms. Jan Phillips.
Hi, I'm Jan Phillips,
and I've been a resident of Durango for over 29 years. Did you say you needed my address
Yes,
as
please.
well? 217 Hillcrest Drive. I'm part of a nonpartisan group called Healthcare Durango. We're committed to informing the public about healthcare. I'm here to advocate for your support for Medicare for All, a single-payer universal healthcare system to service all residents of Durango. Over the past 60 years, 58 other countries established similar systems and pay half of what the U.S. pays for healthcare. Multiple scientific studies of single-payer healthcare have determined it's not only financially feasible, saving billions of dollars for taxpayers, but would also save countless lives. In May, I attended a healthcare forum sponsored by the Chamber of Commerce and Local First. In 2018, Local First heard from an overwhelming number of its members that the rising cost of healthcare was becoming a major obstacle to running their business in La Plata County, including increased difficulty attracting, retaining, and offering health benefits to their employees. They applied for and received a grant to study this onerous challenge. In June, just last month, they came out with the results of their community needs assessment. Between 2008 and 2018, healthcare premium rates in Colorado increased more than 60%. I personally and my small business experienced healthcare premiums the last 2 years that came to over $24,000. Spending for outpatient services in Durango is 87% higher than the state average and one of the highest rates in the country. Residents of Durango have less affordable health care, a shortage of physicians, and soaring drug prices. Expanded Medicare for All would lessen the fiscal burden on local governments. I urge you all to support and sign the resolution for Medicare for All because it's right for our communities. It would include all medications, dental, vision, long-term care, mental health, and addiction treatment. We could stop worrying that a single illness or accident will bankrupt us. It's right for our businesses to attract and retain employees and encourage local entrepreneurs to start businesses. Medicare for All unties healthcare from employment. Workers are free to change jobs. And finally, it's right for Durango. Under the proposed Medicare for All bill, public agencies would be completely exempt from contributing to the Medicare for All Trust Fund. Take whatever the annual budget is for employee health in Durango and make that a zero line item. The 10 to 50% budget windfall could be used to fund our infrastructure, housing, and address our homeless issue. This should be an easy decision for the City Council to make. It's time to demand that our representatives in Denver and Washington, D.C. do the responsible thing and pass single-payer universal health care. By signing this resolution, you let our legislators know that Durango supports improved Medicare for All, improving the sustainability of our families, our schools, our businesses, and especially our city. Thank you, and thank you for all the tireless hours you all put into making Durango a beautiful place to live.
Thank you very much, Ms. Phillips.
Jen, do you have a copy of the resolution?
Yes.
Yeah, I just didn't want to have us passing it around while she was talking.
Yeah,
so
thanks.
it's right here.
We do have a process that we go through to sign on to anything like this, so we'll
Right.
start that process.
Thank you.
If there's anything else I can do or any other information, I can offer.
Thank you. Jamie McMillan, please.
Hello, everyone. I'm Jamie McMillan of 2529 Delwood Avenue. I'm here tonight to talk about the hospitality bill, which is establishment of hospitality lounges and consumption in Durango or in the state that's passed. HB 19-1230, which I think you guys have a copy of. I'll skip the success of the Colorado pot story because it is incredible compared to other states. I'm going to go right to the licensees and what we're looking at as business ventures. Basically, the law is trying to take the area of consumption, which is clearly not permissible now, and put it in an area or control that people can actually use or consume marijuana. And that would be in the form of 3 licenses. One is a dispensary license, much like a tasting room you would go to at a craft beer place. The other one would be purposes for private businesses in hotels, restaurants, yoga studios, art galleries. They can apply for a hospitality license allowing for consumption of marijuana in flower, concentrate, or edibles. But this is a limited sales. This is not a dispensary. So the state has mandated, at least in the beginning, that the sales should be no less than 1 gram of flour, no less than 1 gram of concentrate or edibles. And that sales limit is being set and kind of modified right now by the MED, which is the Marijuana Enforcement Division. I'd like people to think about this in 2 ways. Number one, does it provide a service to our residents, which the state says 90% of our consumption is by residents of Colorado and 10% is by tourists? And second, does it solve a problem? And I think opening up this discussion might lead to some answers to that. And I won't get into the studies done by the lead schools of business on the distribution of the products, but we can talk about that later. But if we apply the facts to our situation in Durango, here's what I think it could do for us. I think there's a need for a hospital solution for our tourists, our residents, for a safe and regulated environment to consume marijuana products. For our restaurants, hotels, innkeepers, and bars, they would have a legitimate place to send people to use these products. And also on the solving the problem in terms of beyond the service, it could cut down on the burden of our law enforcement, our complaint calls that come in for public use, and the confusion that lies with people arriving. So these 3 licensees sort of areas to kind of conclude, a mobile license if you have a tour operation, if you have a business that you've established that you might sell consumption products in, and of course the marijuana aspect of the tasting room idea in front of the dispensaries. So this is passed by legislature. It's up to us as a city and this council, which I hope you'll indulge. You would need to pass that yourself as city members, or we could take it to ballot where we would need a referred initiative to get 15% of the electorate's signature. Either way, this is really about, is this right for Durango? And I really appreciate your time tonight to introduce this, and I hope you had a chance to look at the bill. Look forward to discussing it further.
Thank you very much.
Glad to see all your faces.
Yeah,
by
nice
the
to
way.
see you too. All right, we'll move on to public hearings. We have 3 quasi-judicial hearings tonight. Please note that these public hearings are an opportunity for the community to provide direct input into our public decision-making process. The format for these public hearings is intentionally organized to ensure transparency and fairness for all parties involved. Quasi-judicial hearings require a legal process in which opinions and facts are presented to counsel who act as unbiased decision makers. The applicant has the burden of proof in these proceedings and must present testimony or evidence to support the request. We welcome all public testimony for these hearings, but we do request that it be relevant to the issue at hand. If you would like to speak during one of the public hearings, please sign up on the sign-up sheet below. We do limit comments to 3 minutes. The structure for our public hearings tonight, we have 3 of them again. Staff is going to present the report on initial presentation of facts. I will officially open the public hearing. We will have a presentation by the applicant or the developer. We will have public testimony. I will close the public testimony, and then at this time, we will have questions for council. I'd like to ask City Council to please save all questions for this time in the agenda, and this time they can ask questions to staff, the applicant and developer, or the public. We will then have a response from city staff, response from the applicant or developer, and I will close the public hearing and seek a motion from council. With that, we're going to start with items 9.2.1, a public hearing to consider the Cedar Ridge Planned Development Amendment.
Thank you, Mayor.
Thank you.
Craig Roser, City Planning Department. This is a public hearing to consider a request from the Cedar Ridge Homeowners Association on the behalf of all the unit owners within the project to amend the planned development plating to modify the extent of the platted limited and general common elements associated with the residential units in the approved project. The Cedar Ridge PD is located off of Gigline Gulch Road, just south of the Faringway condominiums, and was annexed and approved in 2007. The project's a 29-unit residential development consisting of 5 live-work unit townhome units, 12 detached single-family patio homes, and 12 duplex townhome units. The proposed plat changes being sought would expand the extent of the limited common elements around the detached single-family and duplex townhome units to provide more yard area and space exclusively with respect to the individual units. The Planning Commission considered this request at their June 3rd meeting. There was no public comment, and following brief discussion by the Commission did vote 5-0 to recommend approval, subject to the conditions as recommended by staff. There's no fiscal or budgetary impact associated with this public hearing or the proposed changes to the PD. The proposal has been determined to be in general conformance with the city's comprehensive plan and the LUDC and the approved Cedar Ridge Plan Development, and it's the recommendation of the Planning Commission that the council by motion approve the Cedar Ridge Plan Development amendments, modifying the extent of the general and limited common elements within the project, and authorize the mayor to sign the amended plat mylars upon completion of all final platting requirements. This is we consider a pretty simple proposal. Just real quickly, I'll go through some of the slides. This is a vicinity map that gives you an idea of where the project is. This is Gigline Gulch Road. This is the roundabout at Fort Lewis Drive. This is Hillcrest Golf Course. This is the Smith Soccer Complex. This is the Faringway Apartments or Faringway Condominiums right next to that. Again, the history of Cedar Ridge was annexed and approved for development as a PD in 2007. It consists of 29 residential units, the 12 detached single-family homes, 12 townhomes configured in 6 duplex structures and 5 live-work townhome units in a single structure. To date, there have been 18 of the units constructed and platted for individual ownerships. There are 11 units remain to be built in the project. Those are 5 duplex units and 1 detached single-family unit. And the constructed units in the project have been platted in 5 phased as-built plattings, and those as-built plattings are what created the footprint of the buildings that are actually conveyed for individual ownership, and also established the extent of the limited common elements associated with each project. The proposed amendment is just that, to amend the extent of the general and limited common elements within the project, and basically it's expanding the limited common area around each of the individual units to provide more exclusive yard area associated with those units. This is the plat that shows the 12 units that have, or the 18 units that have been constructed to date. These are the 5 live-work units. These are the individual platted patio homes, single family. This is the 1 duplex structure that contains 2 residential townhome units. What is being proposed is to essentially create a yard area of limited common space around the individual projects. This is the total project area. The additional units to be built are in this portion of the project, and the plattings that follow with those units will be similar to what's being proposed tonight by the Homeowners Association. This is a blow-up. This shows you a little bit better at the end of the cul-de-sac, the yard area, the limited common that's proposed to be associated with each of these individual units. The same with the townhome. There's a common park area that will remain common to be maintained by the Homeowners Association. So those are pretty much is the extent of what's being proposed. It's been determined that the proposed request does meet the criteria of the LUDC for PD amendments. The proposed changes are also consistent and compatible with the original PD approvals. The platting changes are being proposed by the HOA on the behalf of and with the concurrence of the ownership within the project. And so the recommendation of the Planning Commission is that the council approve the project subject to their findings and conditions as stated in their staff report of June the 3rd, and again have the mayor, when the final plat is ready to be signed, sign the Mylars.
Okay.
I'd be happy to answer any questions you have. Linda Bunk is here representing the Homeowners Association if you have any questions of her.
Okay, thank you. I'm going to ask council to hold questions until we are at that point in the agenda. All right, thank you very much. I'm going to officially open the public hearing Do we have a presentation from the applicant or the developer? Okay. Do we have any public testimony?
I'm the Linda Bunk. My address is 251 East 7th Avenue, and I'm an owner of one of the live work units, and I'm the president of the HOA Association, so I'm the applicant, so to speak, along with the rest of the board. I really have nothing more to add than what Craig has told you, but I'm certainly happy to answer any questions. I think Craig did a very thorough job of covering exactly what we wanted, and every homeowner had to sign a consent form that they were in agreement with this, and Craig has all of those, so I think we've jumped through all the hoops and hope to have your approval of this.
Thank you. And no further public testimony, Mr. Lowe?
No.
Okay. So I'll close the public testimony, and at this time, we'll have questions from council, please, for staff or the applicant.
I was just wondering what prompted the request and what's the impact on the residents?
What was the question?
What prompted this request? What prompted it, and what's the impact?
The prompt was, there was confusion as to HOA being responsible to maintain the yards for the individual units. So if you had a single family unit, there was confusion over if they were responsible to maintain their space or if HOA dues went to take care of that. So it basically was just to clean all of that up and say, yes, we drew lines between everyone's single-family homes, and yes, you are responsible for this and this. So it just made it more equitable and for the people in the live work that don't have yards. So yes, we avoided some confusion, and I don't feel that there was any resistance by anybody in the community. Everyone really wanted to get this cleaned up. So it's been a long time coming, but we're finally there.
Thank you.
Anything else?
Other questions from council?
I was just going to make a comment that typically general common elements are to achieve grading and drainage, specifically on your hillside slope areas and that kind of thing. I was going to ask Craig if staff felt like the general common elements such as grading and drainage, the level changes between each of those units have been achieved at this point, such that we can throw this back to the individual homeowners instead of being maintained forever by the HOA. Seems like a reasonable request, but after those major grading and drainage things have been achieved.
Yeah, the engineering department has looked at the proposal. They have no concerns about this modification to the limited general common. Drainage was initially a concern, but the site has been prepared, and there are no drainage issues up there right now that we're aware of. And as the future units are built, we'll assure that the drainages can be maintained within the general common areas more so than the limited common.
Makes it nicer property ownership and probably better maintenance by the individual homeowners.
Yeah, I think that probably was a big part of the proposal.
Thank you, Linda.
Great, thank you. Any further response from city staff or the developer? Applicant. Okay, I'm going to close the public hearing. Do we have a motion to approve item 9.2.1 from council?
I'd like to make a motion to recommend or to approve the Cedar Ridge Plan Development Plat Amendment subject to the stated findings and conditions in action A above.
I'll second that.
Ms. Phillips, do we have a roll call?
Councilor Noseworthy?
Yes.
Mayor Pro Tem Brookie?
Yes.
Councilor Baxter?
Yes.
Councilor Bateen?
Yes.
Mayor Youssef?
Yes. Okay, moving on to items 9.2.2, a public hearing to consider the Escalante Village Plan Development Amendment.
Craig Rose again, City Planning Department. This is a public hearing to consider a request from Durango Threadworks LLC, represented by Bob Lieb. to amend the recently approved Escalante Village Plan Development to add 2 additional tiny home rental spaces to the project. This amendment would increase the total number of units to 24 from 22, which was approved. The Escalante Village project is located on approximately 1.77 acres of land located at 224 Baker Lane. That's at the end of Baker Lane. Planning Commission heard this request at their June 3rd meeting. There was no public comment, and the commission voted 4-1 to recommend approval of the preliminary plat, subject to the findings and conditions stated in the staff report. The city already provides water, utility, and other services to the area, so there should be no impact to the city. As far as costs, the city will realize some revenues from the project through fees associated with the project. The project is, proposal is in conformance with the city's comprehensive plan and the LUDC and the previously approved PD, and it's the recommendation of the Planning Commission that the council, by motion, approve the amendment to the Escalante Village Plan Development with the findings and conditions as reflected in the Planning Commission's minutes of June 3rd, 2019. Again, I'm going to go through this real quickly because this project was just before the council in May of this year for final approval. This is that tiny home project, and it's again located. What's being proposed is to increase the number of rental spaces for tiny homes from 22 to 24 and to decrease the area of on-site storage units that were a component of the original project that was approved. This shows the vicinity map. I think you're all familiar with it. At the end of Baker Lane, Escalante School, Middle School is here. This is the Walmart property. This is just some pictures of the site. These are the tiny home units, some of which will be placed within the project. This was the original approved layout for the 22 units, 6 spaces on this side of the main entryway. The remaining spaces over here. This was the storage area that was intended to provide for storage of whatever equipment folks that are living in the project might have, bikes and whatnot, that they might need some extra storage space for. What has happened, as I understand it, and Bob can certainly respond in greater detail, is there's been a lot of demand for the unit and spaces within the project and not very much market demand for the associated storage space. And so what he's come back with is a proposal to add, to eliminate the storage in this area and add 2 more rental spaces to the project. So this is the area where those 2 new spaces will go in. The change will not affect anything else associated with the project in terms of the utility layouts or the drainage design or the access design. And again, this is, as we understand it, in large part just based on market demand, and what he's finding is actually the demand for the unit space within the project. These are the review criteria for major plan development amendments, all of which the staff and the Planning Commission feel have been met by this project. There was no public comments received about the project. Staff does support the increase in number of units and believe it can be found to be in compliance with the review criteria, and the slight increase in the unit count will provide some additional housing stock in the area. And this is a project that we're kind of anxious to see what happens with it because it is such a new and unique kind of concept for the community. So again, it's the recommendation that by the Planning Commission that the council by motion approve the amendment to the Escalante Village PD with the findings and conditions reflected in the Planning Commission staff report and minutes of June 3rd of 2019.
Thank you. Do we conclude the presentation? Okay.
Yeah.
I'm going to officially open the public hearing. Do we have a presentation from the applicant or developer?
Good evening, councilors, Madam Mayor. This proposal came, it was originally going to be 24 units and 1 row of storage. And during the initial Planning Commission hearing, one of the commissioners felt that we didn't have enough storage. I thought that after that session, I thought he might be onto something that perhaps I didn't have enough. So I changed the plan, and that's the way it was approved, 22 with 3 rows of storage. Since July, we have been open to taking reservations, wherein people have sent us $500 deposit. It was refundable up until recently, June 1st, I think. We then told people that their deposit is no longer refundable, that they have to make a commitment. And at the time that we started in July of last year, taking them, interestingly enough, by Christmas, we were full. We had as many reservations as we had spaces, but we didn't even fill 2/3 of the first row of storage as far as reservations were concerned. And I thought, ooh, that doesn't fare well, because if we don't have enough, if we have empty storage, we could have had housing units there. So we decided that, oh, excuse me, let me back up a step. After June 1st, when we did decide to go and have the deposits be non-refundable, we did lose a certain number of people who backed out, but currently we only have 3 spaces left, and we still only have about 2/3 of the people, 2/3 of the storage unit of 1 row called for. So, of course, we don't want to sit there and see an income-producing space not producing income. We don't want to devoid our place of having more housing, if that's our goal. And it was caused, we believe, primarily when we would ask people why they didn't sign up for storage, is that we have allowed enough room in the project for people to put a storage unit behind their house. It's most houses are 28, 30 feet long, and there's a 40-foot space, so they can, as long as it's not wider than the house, they're allowed to put their own storage unit there, and that's seemingly what people are opting to do at this point. In the event that we find ourselves at some point with a greater need for storage, we would certainly be able to change it back if we wanted to, because what your approval on this does is just lets us put 2 more spaces there, but put the infrastructure in for them. The infrastructure is just nothing more than the places to plug in that are right next to the houses. And if someday we decide that we need more storage, we just, take out a house if a house is available, and we can still put a row of storage in there. We have upgraded our storage units we were going to do kind of upgraded metal containers, and now we have, I don't think Craig showed them, but we have storage units being made currently that are all wood with pitch roofs, asphalt roofing, and that type of thing. They're a little bit nicer. So even though we're going from 3 to 1, hopefully, it still will be a nice appearing storage unit. I think an asset to the village. So that's the story.
Thank you very much. Appreciate it.
Questions?
Oh, I'm going to wait for questions until we get there in the agenda. We'll first see if we have any public testimony.
There's none.
Okay, you might be able to stay up here. Then I'm going to close the public testimony. Do we have questions from council?
When do you expect the first unit to be occupied?
I don't know. We're behind schedule. It's taking a lot more work, and issues have come up from time to time. We're dealing with a couple right now that have slowed it down. I would like to see us start putting occupants in there September 1st. I don't know if we'll make it or not, but that's the current goal, and we've been communicating with the people. It's a little bit of a different dynamic than people building a normal subdivision where they erect the houses on the property and there it is, and when the house is done, you move in. This is a situation where 7 of the spaces we are providing the tiny home, but the other 17 are spaces that people are bringing a tiny home into town. And some of those, unfortunately, are already here because people thought we might be open by now and they could live there. They have found other places to put their tiny homes temporarily, and some are just storing them there, and some are living there. Others, there's a good handful of others who are going to be arriving later this month, and so we're struggling with them to find a place to put them, and they're also struggling with the aspect that they're going to have to look for temporary housing until we are open and they can put the house in there and plug it in. So I wish I wish I had the exact answer for that, but I don't. You know, it's just one thing or another just keeps jumping in the way. And,
No, it's a new project. It's a different
and
kind of project.
it's
so.
different, and the lot has, for reasons, has turned out to be a bigger challenge than we originally thought. You know, we think, oh, we could just make a flat piece of ground, put some houses on it, and live happily ever after. But it's quite a bit more complicated than that. And we're working through them, and we've had quite a bit of dialogue with staff over some of the issues, and so far we've come to pretty good conclusions and compromises on both sides.
I don't have a question, but I'd like to thank you for taking on those complicated challenge. I think it's an innovative idea. I hope it's very successful, and I just appreciate your doing something to address another option for housing in town. Thank you.
Yeah, thank you.
I was going to ask, it seems that staff's comfortable with this concept, but I was wondering if there was any representations that this storage was intended to be an amenity for each of the tiny home spaces. In other words, you described it as a separate profit center, so assuming that was an additional cost that wasn't part of the basic rental fee for the space lease.
Yeah, if I think I understand your question correctly, yeah, it was. I mean, actually, there was no issue with me switching from one and dropping two houses for two, because again, income potential for storage actually is somewhat higher than for renting a space for a house, other than the capital expense of having to purchase the storage units. But income-wise, it's no issue, and it probably would be better for me if it was storage units, but empty storage units are not better for me. You know.
I guess the more direct question is, it was never a limited common element for any of the lots that were, any of the individual lots that were never assigned a storage unit directly. So you were always intending to rent it to them or some other person outside person.
Right, yeah, and it makes a lot of sense when you think that people are changing to a tiny home existence, that they're going to have a lot of excess things to put somewhere. And it's turning out, interestingly enough, that a lot of these folks, at least the ones that I've communicated with, have already, they've committed to doing that personally, and they've already been in the act of doing it, or they don't have any to start with, and they don't intend on buying a bunch of junk to put around there, So.
Well, I'm comfortable with the fact that you're providing more housing. The net gain to the city is a couple more units, and that there's other opportunities, either in the private marketplace down the road, they can rent a storage unit, or, as you've said, there's room on site to create another shed of their own. So.
Yes.
Did you have another question, Kim? Okay, any other response from applicant or developer then? Okay, I'm gonna, let's see, I have to officially close the public hearing, and I look for a decision by council, but I did want to also say that I sure appreciate the headaches that you're enduring to provide another housing option for our community. It sure seems like there's some strong demand out there for this, so we're too very excited to see how it goes.
Yeah, well, thank you.
Very much so. Do I have a motion from council?
I'll move to approve the amendment to the Escalante Village Plan Development with findings and conditions as reflected in the Planning Commission minutes of June 3, 2019.
Second.
Any further discussion from council? Ms. Phillips, may we please have a roll call?
Mayor Pro Tem Brookie?
Yes.
Councilor Noseworthy?
Yes.
Councilor Bettine?
Yes.
Councilor Baxter?
Yes.
Mayor Youssef?
Yes. Moving on to item 9.2.3, a public hearing to consider the minor subdivision preliminary plot for 875 East 5th Street.
Thank you, Mayor. Craig Roser, Kansas City Planning Department. This is a public hearing to review a proposed subdivision of property at 875 East 5th Street. The applicant is Brian Frederick, and Brian is seeking to split the existing lot, which contains about 11,289 square feet, into two smaller lots, one of which would be about a little under 6,500 square feet, and that would contain the existing residence, and the remainder of the property is about 4,800 square feet would be the second lot. The new lot would be used for future development as either single-family residence or, it's been indicated, a single-family residence with an accessory dwelling unit. The Planning Commission heard this item at their June 3rd meeting. There was no public comment, and the commission voted 5-0 to recommend approval of the preliminary plat, subject to findings and conditions as stated in the staff report. If the council approves the preliminary plan tonight, the final plat will then come back and be reviewed, but just at the staff level administratively. Changes to the plat, if any, between preliminary and final plan review should be minor. The city already provides services in this area of the community. The city will realize some revenues from increased fees associated with the subdivision and development on the lots, and the cost of providing services to the project should be pretty typical. The proposal is in compliance with the city's comp plan and the LUDC, and it's the recommendation of the Planning Commission as the council by motion approve the Frederick minor subdivision with findings and conditions as reflected in the Planning Commission minutes of June 3rd, and delegate final plan review authority to the code administrator and staff, and direct the mayor to sign the final plat mylars upon completion of all final platting requirements. This real quickly. Again, his proposal to subdivide about a 1,103 square foot lot into two parcels. This is the property location. This is 9th Avenue, this is 5th Street. Little blow up of the site. This is the zoning of the property is EN1 zone. Minimum lot size in the EN1 zone is 4,000 square feet. Both of the lots being created by this subdivision are consistent with the zoning lot size requirements. This is a comp plan of the site. And this is the actual subdivision plat of what's being proposed. This is the existing house that would remain on the larger property. Essentially, the lot line would come here. This new lot, which is defined as Lot A, contains some existing outbuildings that would be scraped, and this is where the new residence and possible ADU would be constructed in the future. Pretty simple subdivision proposal. All of the issues associated with the subdivision have been addressed at the preliminary plan stage, and again, staff and the Planning Commission is recommending approval. Brian is here tonight if you have any questions of him, and I'm available for any questions.
Thank you very much. I'm going to officially open the public hearing. Would the applicant or developer like to present?
Thank you, City Council members and Mayor Youssef. My name is Brian Frederick, and I am the applicant. I'm here with my design and development team as well, so if there's any nuts and bolts questions, we can kind of dive into that as well. Address 2180 Crestview Drive, and yeah, Craig kind of put it all out there pretty simply and basically, so here to answer any questions.
Great, thank you very much. Do we have any public testimony for this?
We do not.
Okay, I'm going to close the public testimony. Questions from council?
So the parking for the Lot B, will that now be off-street parking since there won't be a garage?
And parking for Lot B can be provided in a driveway that's located in this area.
Okay, so there's a driveway there?
Yeah.
Okay. And then for Lot A, there will also be off-street parking?
It would be required to be off-street. It would probably come off of the alley. I think the intent would be that the access to the unit would be off of the alley. That would be addressed at the time we get building permit applications and site plan review of what exactly is being proposed on the property.
If the applicant so desired at some point in the future on Lot B, would there be the capability of building a garage?
Yeah. Okay. Sure. Or potentially an accessory unit.
Right, or both, right?
Yeah, and or both.
As long as they maintain their lot coverage.
Yeah.
I would point out that the unique thing about this, obviously the corner property, but also the 75-foot width of the original property offers a lot of opportunity there. That we see a lot of these small lots. I can point to some on 10th Street, for example, that are really small and shallow lots and not very desirable, but because of the that 75-foot dimension, it makes that Lot B, or Lot A, the new Lot A, pretty usable. And accessed off the side street there, so seems like a pretty good opportunity.
At 4,800 square feet, it's a pretty decent lot size. And the smaller lots in this area community go, and like you say, with the dimensions, I think it's going to be very developable.
The existing trees might be lost in this effort, but
Yeah. Again,
We're going to save 2 of the 3.
Okay. And that would be addressed as part of the site plan review for the building permit applications.
Any further questions from council? Great. I'm going to close the public hearing unless there's no further response from staff or the applicant. Okay. I'll close the public hearing and seek a decision from council.
I would make a motion to recommend approval of the proposed Frederick Minor subdivision with the finding that the subdivision meets the evaluation criteria of the LUDC for subdivision plans. That's not what that says up there, but that's what it says in here, and is subject to the conditions outlined in the staff report.
I will second that. Chris, go right ahead.
All right, I'll second.
Any further discussion? Ms. Phillips, can we have a roll call, please?
Councilor Bateen?
Yes.
Councilor Baxter?
Yes.
Councilor Noseworthy?
Yes.
Mayor Pro Tem Brookie?
Yes.
Mayor Youssef?
Yes. Great. Moving into item number 11, introduction of ordinances. Dirk, can we have a reading of item 11.1, and can you give us a number, please?
Yes, this is ordinance 2019-17, an ordinance amending section 4-3-1-3 of the City of Durango Land Use and Development Code, adopting by reference the revised City of Durango Storm Drainage Design Criteria Manual, July 2019, and declaring an effective date.
Discussion, questions from council? Do we have a motion then to approve? Item 11.1. And did you give us a number, Dirk?
I did, it's 2019-17.
Okay.
I will make a motion to approve item number 2019-17, ordinance number 2019-17.
And I would second that motion.
Any further discussion? Ms. Phillips?
Mayor Pro Tem Brookie?
Yes.
Councilor Bateen?
Yes.
Councilor Baxter?
Yes.
Councilor Noseworthy?
Yes.
Mayor Youssef?
Yes. Moving on to council reports and actions. Councilors, do we have any updates to share at this time? Any liaison council commission reports?
I have one. I'd like
Okay.
to do. So on Monday, which I guess was just yesterday, I participated in the Alliance's monthly board meeting and a strategic planning session, so about 4 hours of meeting. So first, let me just acknowledge the board members' hard work on that, and I wanted to share with you some of the outcome of that meeting, and then subsequently this morning, the investors meeting, which was follow-up to that. So first of all, on the update, we have heard from PACE that we should be getting 3 to 5 candidates for the executive position, hopefully by the end of this month, and that's going forward. We're hoping to, if all goes well, we would possibly have a selection in early September. So that's kind of the goal on that. We talked about some of the issues that we might look at as a strategic goals going forward. The previous ones were around the airport, the industrial park, and the internet. And we felt that the airport is going quite well. Those things have been addressed, and the internet, we've been making progress. Some of the issues that we discussed was working with the planning department, commission, both in the city and in the county. Are there ways that we can streamline the process, make it somewhat easier for developers, issues there? Are there some things that we see that people talk about as consistent issues that we should be looking at is how can we be more customer service oriented. This is not a criticism, this is just a way of continuous improvement. So that was one area that they looked at taking on, and within that, are there some things that we could be doing to promote public-private partnerships, some incentives? We talked about some of the things that other cities have been doing. So that was one area. We talked about the business park and the need for that to really be addressed. We've been talking about it for some time, but we recognize that we are possibly losing businesses due to that lack of space, more than possibly. And another issue that was really quite interesting that came up is that affordable housing, not low-income housing and not high-income housing, but affordable, attainable housing impacts our ability to drive for economic development. And where we're at is we recognize that there are other agencies in town with expertise, but it might be on a role to help advocate for that kind of housing plan. I discussed that we've developed a housing plan, and it may be that we need to look at the implementation of that housing plan and dollars associated with it. And that I explained that we'll be having a session on the goals coming up. So that was some of the big issues. We also then brought that to the members this morning with a fist of 5. How do you rate these activities? Fist being 0, 5 being top priority. And that we had quite a bit of good discussion around it. The one thing that came up is that the Alliance recognized that it receives funding from the city and from the county, and there can be some hesitation to offer constructive feedback when you also recognize that you're getting funding. The phrase was, don't bite the hand that feeds you. Right. And I went out of my way to assure them that we view ourselves as in a partnership relationship, and that constructive feedback is good, and that we welcome ideas for improvement. So I think that's important to just convey, and this is not their full strategic plan. It was just the sharing of the information as it now stands.
Thank you.
And then I would remind you that the Economic Summit is set for October 23rd for the Alliance.
Thank you. And I want to thank you for attending.
Oh, you're most welcome.
Strategic planning and thank you very much.
I think when we hear discussions like that, we hear this a lot, we need to streamline. It would be I always ask the question, what exactly did you get hung up with?
Yeah.
At what point in the process did you feel that we were not customer friendly? And I know we've got some weaknesses perhaps in inspections and things like that people feel exhausted by to some respect. But by and large, this body, City Council, doesn't see very many large planning projects because we streamline.
Right.
Incredibly streamlined over what I've experienced over a few decades of taking projects through this process. I also have the benefit of working in a number of jurisdictions where it is much, much, much more cumbersome than it is here. So I always like to hear what those folks have encountered so that we can address them specifically, because once we know what the problem is, we can deal with it as always. And so please encourage them to document that if they would.
I think that that's what came out of this meeting today, is that we really do welcome that kind of feedback.
Yeah.
And that we need to hear it if we want to improve.
Great.
So.
Excellent. Other updates?
I've got one. Just want to encourage everyone to listen in to this Saturday on KDGO 1240 AM and 98.3 FM from 3 to 4 p.m. And you can hear Jack Llewellyn from the Durango Chamber of Commerce and yours truly give a city update and try to entertain people for almost an hour. I went into the session not actually realizing it was an hour-long program. Fortunately, I had voluminous notes and copious commentary. And so please tune in. And I want to thank American General Media for making that opportunity available to the city and that airtime available to us.
Great. Other comments? Updates? Go ahead.
Yeah, that'll be quite the tag team. You and Jack Llewellyn, that's a good combo.
Yeah.
Well, I usually update about the Airport Commission, but we were in fact in Breckenridge at the Colorado Municipal League. Well, they had our last Airport Commission meeting. I'd like to get some updates. We'll hear from Mr. Vicari soon on the efforts that are going on out there. We are under construction, and some new things are happening at the airport. Similarly, the library. I drove back from Denver yesterday to attend the 4:30 library meeting, which wasn't in existence because they are on, as I should have known, summer sabbatical. So I'll be attending the library board in the fall as scheduled. So we have nothing to report on that, but I would like to encourage the councilors to think about, as we approach the funding stream opportunities, that we should really look closely at that asset and try to get that open on Sundays, if at all possible. That's my lobbying for the day.
Great.
Sorry.
So the Utilities Commission is in the midst of receiving a draft rate study and reviewing it and sending it back for more comments and more upgrades and more detail or more changes. And as such, because they felt like they wanted to be more informed and inform the rate study further, they've decided to have an additional meeting on July 15th. I do not know yet the time or the place specifically, but to bring back their comments and thoughts about the rate study. It seems like a pretty simple concept, but there's several things that have been addressed in it, and one is the outside area service rates were 2 times the inside area service rates for certain services, and the consultants were asked to look at that and to actually see how that was supported in the infrastructure and in the costs, and they actually came back with some recommended changes, and the Utilities Commission wants to look at that. And also the question of, so where do we put our tiers as far as charges for water? And what's the goal of each tier? Is it to, at some point, are we trying to create a conservation effort through those tiers? Are we trying to have water be affordable for families of 4, or for normal users? So I felt the Utilities Commission members were incredibly thoughtful in their approach to this and to their conversations. And at the same time, what we also have to do, of course, is have enough funds to pay for operations, maintenance, capital projects, the water treatment plant, whatever may be on that list. And so it's actually this amazing, complex balancing act. We're also talking about increases over the coming years, all sorts of very complex things. So obviously they did not feel that even 2 meetings of discussion on this were enough, and before they made a decision about bringing it forward to City Council, they wanted to make sure they'd spent a lot of time on the rate study. So that's, yeah, I really appreciated listening to these gentlemen talk about ways of thinking and viewpoints. They're really invested in this conversation, and they're a great commission, so I really appreciate that.
Great. And I had a good meeting with the Creative Autonomy Commission. We had some really great updates. The Community Relations Commission provided an update, and I did want to let council know that I spoke with them about a banner for the council room here.
Oh, nice.
And they are working with our city staff and also with our public information officials to create a banner that's suitable, given that we're live on TV and that isn't too distracting, but also shows our support. So that's really exciting. And the Community Relations Commission has found room for this banner in their budget.
Nice.
So that's exciting. We also had a Durango Creative District update from Local First. Haley Kerman, Monique DeGiorgio, and Bill Carver, which was really interesting. They talked about their efforts to work on this creative district and get it officially approved as a creative district, reviewing that they're working to build on an economy that values people. They suggested they still have a bit of fundraising left to do to apply for the designation from the state. They reviewed that it is in the 2017 comp plan, which includes a creative district, and they're looking at anything that makes Durango unique. And so they're trying to kind of, through this process, identify our culture. They are looking at a boundary for this process of downtown, FLC, Bodo Park, and some of North Main. And stage 3 of this process, they're expecting to be completed by September of 2019, so they're getting closer. It's really exciting. So that was a really great meeting. I enjoyed being part of it, and I'm very excited. I'll keep you updated on the banner. And that was my only update as well. So for that, after that, then I think we can move on to future potential agenda items. Any for council? I just had a couple dates. Do you have?
Well, I was just going to suggest, I think the one thing that we haven't discussed and we had talked about was kind of the structure of meetings and issues around that.
You're right. We were talking about meeting protocols. And that was originally in a discussion in our retreat. If we could add that to our discussion, we need to get that on. I don't think we need much time. I would suggest maybe 15 minutes on an agenda. But we had talked about kind of order of things and a few other things. I need to pull my notes back up. So thank you for bringing that back up.
That would be a study session, not a council meeting.
Correct. I think so. Yeah.
Would we need to take a vote?
Well, we didn't on our other items.
Well, typically you would have the study session, work out the details, and then we could draft a resolution for you to put on consent and adopt it.
Great. Thank you. And then I just wanted to use this time to talk about 2 dates because they are agenda items, future agenda items. We have a joint City Council Board of County Commissioner meeting this Thursday, July 11th at 7:30 a.m. at the Rec Center. We're going to get an update on our homeless strategic plan from Athena Group, who has been hired to do this work. We're going to talk about Durango Fire Protection District impact fees, and we're going to get an update from staff on La Posta Road development issues. And next week, we have a full week. We have another City Council meeting on July 16th, and we have 2 full-day City Council retreat on Wednesday and Thursday of next week, July 17th and 18th, starting at 7:30 a.m. at the Rec Center. In the Wyndham Room, we're going to be creating create new City Council goals, which is important because our City Council goals influence the budget. And we're beginning to be creating a new evaluation system for our 3 appointees, the city attorney, city manager, and municipal judge. We're looking forward to doing some really good, productive work together. And just to reiterate to the community, these are open meetings. Everyone is welcome to attend. We will be taking minutes, and we will be recording our sessions. And anything else from council? Staff? Okay. With that, then, I will adjourn the meeting. We will see you next Tuesday, July 16th. Thank you very much.